The flu. Every year we hear it's coming. We know people who have had the flu, and we hear more and more about the flu vaccine. But did you know that upwards of 40,000 people in the U.S. die each year from the flu? In early April, the 37-year-old mayor of Rochester, New York, was hospitalized because of the flu. There's no doubt that the flu can be disastrous. Hello, and welcome to A Minute for Health, brought to you by the American Pharmacists Association, Academy of Student Pharmacists, the Wegmans School of Pharmacy, and St. John Fisher College. I'm John Snyder, a second-year student in the Wegmans School of Pharmacy. In today's episode, we'll take a look at the flu virus and the flu vaccine. Students and faculty from the Wegmans School of Pharmacy will be discussing what, exactly, the flu bug really is, why getting vaccinated is so important, some common myths associated with getting a flu shot, and who should be receiving those vaccinations. We will also demonstrate just how simple and relatively painless it can be to receive your flu vaccine from your local pharmacist. Stay with us.
We all have heard about the flu before, but what exactly is it?
Well, Rosetta, the flu is caused by the influenza virus. A virus is an extremely small infectious agent that can hijack the body of its host and make it sick. Viruses are so small that they can even infect bacteria too.
That's a really scary thought, Andrew. The flu virus manifests itself as a contagious, lung-based illness that varies in severity. Symptoms can range anywhere from a mild flu response, such as a fever, chills, or body aches, to hospitalization or even death.
So, it can spread from person to person. Are the symptoms always so dangerous?
Not always. It can be pretty mild in some cases, but pretty bad in others.
That's a relief, since both the flu and the common cold are both viruses. How can I tell when I have one or the other?
That's a great question. It's important not to mix the flu virus up with the common cold, another virus with similar symptoms. Generally speaking, the flu is the more serious of the two.
With the flu, it's pretty common to run a fever of over 100 degrees Fahrenheit for a few days at a time. With the cold virus, you may or may not run a fever, but if you do, it's seldom above 100 degrees. Headaches are also much more common with a fever than a cold. Both can cause a cough and a sore throat, but if you have a continuous sense of fatigue, or if you have any other symptoms, you should definitely head over to your doctor to get checked out for the flu.
So how exactly does someone get the flu? Should I just lock myself away in my apartment and wait for the flu season to end?
That won't be necessary, Rosetta. Most experts believe that the flu is spread mainly by droplets made when people cough or sneeze or talk. These droplets can land in the mouths or noses of people nearby and might get them sick too. The most common way people catch the flu is from encountering these droplets on something like a pen or even their hands, and then touching their eyes, nose, or mouth.
It's a good thing I've gotten into the habit of washing my hands so often.
Actually, Rosetta, that's one of the best things you can do. Researchers at Penn State stress good hand hygiene as a way to lower your chances of getting the flu. My favorite recommendation from them has to be when washing your hands with soap and water, make it fast, foamy, and furious for 15 to 20 seconds. If soap and water are not available, alcohol-based hand sanitizer can be used. Remember guys, make it fast, foamy, and furious.
So what else can I do to lower my chances of getting the flu?
Getting your annual flu shot at your pharmacy is really going to help you out there. You don't even need to make an appointment, and it's generally completely covered by your insurance.
Wow, it's great that I can just go to the pharmacy and get it whenever I need. So how does the flu vaccine actually work?
The flu vaccine actually works by helping your body produce antibodies to help fight off the infection. Think of these antibodies as your personal canine unit for your immune system. They sniff out any bad things in your body so that your immune SWAT team can rush in and wipe them out.
That's pretty awesome. So if I get the flu shot while I'm sick, I should be good then?
Actually, it takes about 2 weeks for these antibodies to build up, so it's really important to get vaccinated before the flu season hits. Don't leave it to chance and get your flu shot as early on as you can. It's never a good idea to play Russian roulette with your health.
That's a great point. Well, guys, thank you. I learned a lot from today's discussion.
So now that we've discussed what the flu virus is and talked a little bit about the vaccine, let's take a look at who should be getting vaccinated. The short answer is almost everyone. With very few exceptions, everyone over the age of 6 months should receive an annual flu shot. It is especially important to be vaccinated every year if you have any health concerns such as diabetes, asthma, or COPD, because you're at high risk for developing serious complications from the flu, such as pneumonia. Because your immune system weakens as you age, adults 65 and over are more susceptible to the flu and should also have an annual flu shot. If you're involved in taking care of an elderly adult or young child who is at risk for getting the flu, you should also make having a flu shot a high priority. The last thing anyone wants to do is to spread the flu to their loved ones. What if you're pregnant? It may come as a surprise to some that it is absolutely safe for pregnant women to get vaccinated. In fact, the CDC states that pregnant women have a higher risk for serious complications from influenza than non-pregnant women of reproductive age. The influenza vaccine will help protect pregnant women, their unborn babies, and protect the baby after birth. Don't put yourself or your child at risk when it comes to the flu. Each year, an average of 20,000 children under the age of 5 are hospitalized because of influenza complications. While it's never easy to bring the little ones in for the traditional needle-based vaccine, a relatively new form of the flu vaccine exists as a nose spray. Flu Mist is a completely needle-free vaccine that is generally available to children over the age of 3 if they are able to sniff in the nasal mist. And even if your child is not able to get the flu mist, a bit of discomfort from the shot is worth the peace of mind that comes from knowing your child is not at risk for the flu or serious complications. In some states, children under the age of 18 must get their flu vaccine, injection, or flu mist at their doctor's office. So check with your doctor or pharmacist before bringing your children in for their vaccine. Now, there are certain patients who should not be getting vaccinated. If you are already sick, it is best to wait until you are feeling better to get a flu vaccine. For a long time, it was thought that if you are allergic to eggs, you couldn't receive a flu vaccine. That used to be true. But now there's a specific non-egg containing flu vaccine called Flublok, available for those with an egg allergy. Be sure to tell your doctor or pharmacist if you have an egg allergy so that they use the right product to avoid an allergic reaction. If you have been diagnosed with Guillain-Barré syndrome, you should speak with your physician before getting your vaccination. Despite the overwhelming amount of information on the safety of the flu vaccine, the amount of false information being pushed forward continues to grow daily. Thankfully, Michelle and Dr. Sapinoro are here to help clear the air and address some of the more common myths associated with the vaccine.
Hi, my name is Michelle Zaepfel. I'd like to introduce Dr. Ramil Sapinoro from the Wegmans School of Pharmacy. Dr. Sapinoro received his BS in biology from Pacific University and went on to receive his PhD in microbiology and immunology from the University of Rochester School of Medicine and Dentistry. He currently teaches immunology at the Wegmans School of Pharmacy and is an expert when it comes to those pesky bugs that make us feel sick, just like the flu virus. Welcome, Dr. Sapinoro.
Thanks for that nice introduction, Michelle. I look forward to kind of clearing up some of these misconceptions about influenza infections as well as the flu vaccine. So let's get started.
Absolutely, thank you. So my first question of the day for you is that, can the flu shot actually give me the flu?
So the most common flu shot that people will get is made from a killed or inactivated virus. So in simple terms, the virus itself cannot affect or infect or harm the individual, but they have enough of a response to actually teach the immune response to sort of prevent future influenza infections. It's never too late to get an influenza vaccine. The peak season is from winter into March, and so it just takes about 2 weeks for the vaccine to actually get up and induce an immune response. So during that time, you may be infected by other types of respiratory viruses, but it's always never too late to get the flu vaccine.
Great. That's something that's definitely good to know, that it's not too late and that you can still get the flu shot even when you don't think you can. So my next question for you of the day is, do you need to get the flu shot every year?
So influenza viruses are actually constantly evolving and changing annually. And so part of the big reason for an annual influenza vaccine is that we want the vaccine to match the currently circulating strains. And so it's very important to get vaccinated annually so that you're protected against the current strain that is circulating around the world.
Absolutely. And now something that I see all the time is the use of antibiotics in treating the flu. Can you please clarify for us as to why antibiotics are not an effective therapy?
So antibiotics aren't going to be an effective therapy for flu infections because the flu is caused by a virus, whereas antibiotics are only effective against bacterial infections. There are some bacterial infections that can cause respiratory symptoms, and in those cases, you can definitely use an antibiotic to treat those symptoms. But if it's a viral infection from the flu, those antibiotics won't be very effective at all.
Well, hopefully this year we won't be seeing as many prescriptions of antibiotics for the treatment of the flu.
Yes.
So my next question for you of the day is perhaps touching upon the most controversial statement about the flu vaccine. Can children get autism actually from having the flu vaccine?
So that is a big controversial misconception that getting vaccinated with the flu vaccine or other types of vaccines lead to autism. And most of this controversy stemmed from a 1998 study done in the United Kingdom that showed that kids who got the measles, mumps, and rubella vaccine had a higher incidence of autism. Since that time, the paper has been retracted, much of the data has been discredited, and the physician who ran that study lost his license due to the inaccuracies of that study. And so currently there are no studies that show any type of scientific link between getting vaccinated and getting autism. Most of the higher incidence of autism that we see today may be due to higher diagnoses of different types of disorders on the autism spectrum.
This is very good information for all of us because this is something that a lot of people do have a huge misconception on. So thank you for clearing that up. My last question of the day has to do with the potential dangers of the flu vaccination. Are the side effects or reactions of getting the flu shot perhaps even worse than just getting the flu?
So the most common side effects that we see with individuals who get the flu shot is redness and soreness at the site of injection, as well as feeling a little bit run down for about a day or two after getting the flu shot. Following a natural influenza infection, those individuals can have more severe symptoms that can lead to hospitalizations, as well as secondary bacterial and viral infections. And so when you weigh those options of getting sore or redness on the arm for a day or two versus being hospitalized, that's something to think about when you want to get the flu shot.
Great. Well, thank you so much for joining us today.
Thanks.
Most people know that you can get vaccinated at your doctor's office, but did you know that your local pharmacy can give the vaccine to those 18 and older with or without an appointment? Now that we all know about the flu virus and the flu vaccine, let's take a trip to our local pharmacy and watch the actual administration of the vaccine to a patient.
Hi, how can I help you today?
Hi, how are you? I'd like to get a flu shot today if I could.
Hi, I'm Dr. Crigliano. Why don't you have a seat and we'll get started.
Okay, thank you.
Have you ever had a flu shot before?
I have, yes.
Oh, great. Well, it's nice that pharmacists are now available to give flu shots. And there's over 150,000 pharmacists trained as immunizers now. So, we actually are producing about 25% or administering about 25% of all the vaccines, flu shots in the country now.
Okay.
Do you have an appointment?
I don't actually. I was hoping I could just come in and get a flu shot today.
And that's one of the nice things about being able to get flu administered at your local pharmacy is the convenience of just being able to walk in.
Okay.
So I have a few screening questions I need to ask you before we get started.
Okay, sure.
Okay. So Steve, how are you feeling today?
I'm feeling well.
Okay, good. Have you had any allergic reactions to eggs in the past?
No, I haven't.
All right, good. How about if you've received any vaccines in the past, have you ever fainted or had an adverse reaction?
No, nothing like that.
Good, good. Has anyone ever told you you have Guillain-Barré syndrome?
No, I actually don't know what that is.
All right, well, if you don't know, then you probably don't have it.
Okay.
All right, so this checklist is something I'll have you sign at the end, and we'll get on with the vaccination. So one nice thing about flu vaccine that we have now, it's all available in pre-filled syringes. So we can easily administer these vaccines.
Okay.
So let me take one of my syringes out here, and we'll get started. And I'm going to put some gloves on to protect myself and to protect you. And Steve, if you could roll up your sleeve.
Sure.
Okay, Steve, the next thing I'm going to do is I'm going to alcohol the area so it's nice and clean. And then I'm just going to administer the shot. How was that?
Wasn't bad at all.
Pretty easy. That's one of the nice things about the new immunization. Now let me get a Band-Aid on that so we can make sure that we protect you. So I can get this. There you go.
Okay, thank you.
And last but not least, Steve, because you've gotten your flu shot today, going to give you a sticker that shows everybody prominently that you've got your flu shot.
Okay, thank you.
All right.
Never knew that getting a flu shot could be so easy.
That's one of the nice things about having flu being administered by pharmacists in your local pharmacy. It's easy and it's accessible to the public.
Getting the flu is a scary prospect. It can cause headaches, severe coughs, swelling in your throat, fevers, and in extreme cases, it can require hospitalization and even lead to death. That doesn't mean we are defenseless against the flu virus. Today we learned that fighting the flu can be as simple as washing your hands frequently, keeping in contact with your primary care provider for treatment immediately after coming down with symptoms, and going to the pharmacy to get your annual flu shot. The flu shot is a safe choice to help prevent the flu virus from infecting you and your family. It's as simple to get as it is to take a trip to your local pharmacy. This flu season, keep you and your family safe. Make sure everyone meets with their pharmacist or physician for their flu vaccine this year. I'm John Snyder, and this has been A Minute for Health from the Wegmans School of Pharmacy in St. John Fisher College.